Okay, everyone. I am so excited for us to be here for this LinkedIn Live session. I know that it's lunchtime, so many of you guys maybe either if you're on the East Coast like us, watching during your lunch hour, taking a little sneak peek. And if you are on the West Coast or somewhere else, you may be catching this as you get into work, or you may catch it later. So don't be alarmed if you miss anything because it'll be here on LinkedIn forever. And it'll also be shared on YouTube later. So I am just super excited for this health tech highlight because today we're talking about FemTech, and that's a passion of mine. So we have Dr. Brittany Barreto here, and I just want to give you an opportunity to just tell us a little bit about yourself.
Thank you so much for having me here. I'm Dr. Brittany Barreto. I'm a scientist by training, so PhD in molecular and human genetics. I'm a serial entrepreneur because I had too much personality to work in a lab my whole life. I know there's other extroverted scientists out there that know what I'm talking about. I had started several startups, and then I worked in venture capital, investing in Texas-based startups, actually. And that's when I came across FemTech, women's health companies, and I became really passionate about it. And that's actually when I realized how underserved the industry was. In the last 5 years, I've dedicated my life and career to creating an industry that is thriving and growing and expanding. And I'm excited to talk more about it today.
I'm excited too. And for those listeners out there, I'd love for you to share a little bit about what FemTech is.
Sure. So FemTech is an industry, but it's also a movement. So the industry it's essentially solutions to conditions that solely, disproportionately, or differently affect females. What I mean by that is that it's not just boobs and tubes anymore. So women's health is more than just pregnancy and breast cancer. It's also autoimmune disease because it disproportionately affects women. It's migraines, it's gut health, it's bone health, it's brain health. And so, and that's really taking us into what I mean by it's a movement, because essentially the backdrop to scientific discovery and healthcare innovation has been based on a male paradigm. So everything we understand from cell lines, animal models, even clinical trial data has truly been based on a male basis. And so today we are saying women are not small men, and that we need to reanalyze all of our data using sex and gender lenses, understanding what is the biological differences of our metabolism. Is this drug dosage the right dosage for a female body? Or does this medical device fit a female's body as well as it fits a male body? And so it's a movement, but it's also an industry filled with medical devices, digital health apps, therapeutics, diagnostics, and many more.
I love this. And I love that you mentioned that it's not just boobs and tubes, because for those who may not be familiar with me, my name is Arkita DeRowan. I am also working in the FemTech realm and some other health tech things as a digital health risk manager, but I'm also a physician. And as a family physician, it was very frustrating to talk to
say
women
it lightly.
who, of course, are trying to stay on top of their health, because we know that women are the cornerstone of healthcare. The only reason that most people in the family go to the doctor is because of women. I tell men when they come, it's probably one of 4 reasons. Your wife or your mother or your girlfriend told you to come. Your job told you to come, or a school form or something like that. You're in a lot of pain and you think you're dying, or you think you have an STD. So most of the time it's because you're women and you like push you forward. So for healthcare, it was frustrating because yes, women will stay on top of it with going to get their breast exam and getting their pap smears, but there's so much more to you than your vagina. And it's wonderful that we're starting to talk about that.
Yep, absolutely. And it really speaks to the business opportunity. Again, I come from investing, and one of my main missions is to show how great of an investment women's health is, because we are so underfunded from the government level. We've been able to demonstrate how much more GDP and economic growth we can have if we invested even just a little bit of money into women's health, but also on the investment side, because like you said, the main consumer is women. But the thing that they're actually consuming is either solutions that don't work for them or solutions for their family, but they are in the front row. And so they are waiting and excited and impatient actually for solutions. And so when a new solution actually does come to market, like we actually just heard about Tampax and all the major tampon companies having lead and arsenic in their tampons. This research just came out this week. Women are saying, okay, well then who's the new brand that I'm going to buy from? Because I want something safe in my body. And so these are women with money, with education, ready to do better for themselves. And they're just waiting for solutions to come to market.
I love that. And I think that that's a critical conversation to have, especially since we know that women are getting the least amount of funding, and especially women of color. And on top of that, a lot of the FemTech organizations that are out there that are getting funding are usually like head by men.
Yep.
So how can we work to change that?
Yes, unfortunately, we know that women get a very, very small proportion of investment dollars in comparison to male founders. Something that's very interesting is that FemTech is predominantly founded by female founders. So we have about 80% of our founders are female. That is higher. And I'm talking like usually most tech industries has 20% female founders. So the fact that we have 80% female founders, dramatically higher proportion. And it's really women taking matters into their own hands. Most of our founders are actually what I call patient advocates. So they are themselves survivors of, cervical cancer, or they're an endometriosis warrior, or they have had chronic migraines. And so they're taking matters into their own hands and starting these startups. So what we see is we have that gender discrepancy in the investment, but then we look at FemTech. You also have to be, as an investor, very personally excited about a topic to put your money into it. The predominant gender in investing is male. And so what we see is that we see a lot of guys saying, well, that seems important in like a really big market, but I don't really want to talk about heavy menstrual bleeding every day in my investment portfolio, or I don't want to talk about menopausal hot flashes. And so we see this lack of investment because men are either uncomfortable or unfamiliar with these topics. So some hope, because I'm always about like, what's the positive here? The positive is that we're seeing more women getting involved in investing, and they don't need to be convinced that these are important issues, and they don't need to even be educated as much into what it is. I've heard some crazy stories about some basic sex ed essentially that founders are giving to male investors to bring them up to speed about what a period is. And so more women in finance will do really great for funding FemTech, but also being able to destigmatize, make it not taboo to talk about women's health. And the more that men are able and invited into the conversation to talk about menstruation, to talk about vaginal dryness or breastfeeding, the more that they're going to be comfortable actually becoming an investor in these topics, because they're going to say, I've heard a lot about this. Every woman in my life is talking about this, or I even have men in my life talking about their wives experiencing this. And so I know it's a real issue, and I'm more comfortable talking about it because I now have the experience having talked about it. When you have for the first time ever in a deal room saying the word vaginal dryness, the likelihood of them investing is little. So we need to actually make this a mainstream topic of conversation so that these conversions can happen in the deal room.
I couldn't agree more. And I definitely see that, in social media, where we're kind of working and moving past like educating people in the closed door rooms or the primary care offices, things like that. And we're going on social media. We're talking about these topics. People are talking about them more with families. Like there are so many women who are dealing with issues that may have a genetic component, may have a component that may be influenced by lifestyle, but most people in your family have similar things. So like, for instance, people who may have fibroids may not know that their mom and their grandma also had it because they aren't necessarily talking about these kinds of things. So the more that we normalize it in conversation and talk about the tampons having these chemicals, and talk about how we're not having as much research geared towards women, like until recently, I honestly did not know that women weren't even really allowed in research projects until the 90s. So that's
Yep.
crazy.
Yeah. And speaking of that generational transfer of information, if you in your family unit know grandma had really heavy periods and painful periods, and mom has really heavy and painful periods, and then you have really heavy and painful periods, you may just think that's just how it is, right? But actually what it is uterine fibroids, right? And it's this cultural dropping down of each generation of, oh, well, if when your mother tells you, oh, well, that's how I have experienced it, it's normal, you then think it's normal, whereas it's actually a heritable issue that can be addressed.
Absolutely. And you have FemHealth Insights. Can you tell us a little bit about that and how it plays a crucial role in advancing women's health?
Absolutely. Yeah. So I have three main brands that I'd love to tell your audience about. And first, we have FemHealth Insights, and that's my boutique consulting firm. So we consult pharma companies, corporations, governments, investors, private equity about women's health innovation. And that looks like helping them find investment targets or acquisition targets. It helps them understand, hey, if we have a product working really well in Germany, what would be the right marketing messages for an American audience if we want to expand this product to the US market? So it's a women's health intelligence, market intelligence consulting firm. You can learn more about that and reach out to us at femhealthinsights.com. Then I have my podcast. So my podcast is called FemTech Focus. FemTech Focus, you can find it on any streaming platform, your Spotify's, your Apple Podcasts. And we have over 250 episodes, which are interview-based interviews with experts, researchers, politicians, investors in women's health. And then I have my book coming up, and I know we're going to talk about that, but I'll just mention it briefly now that I just wrote the first book on FemTech called Unlocking Women's Health, and it's coming out in September. Pre-sales are live now at drbrittanybarreto.com. That's drbrittanybarreto.com. And you can get a pre-sale there, and the books will start to ship out in September.
I love that. And it's so inspiring that you are working to impact women's health and FemTech in this manner, and then helping others kind of improve their ideas and work to kind of better the way that they're approaching their strategies in order to not only promote different brands and all of those kinds of things, but actually make an impact in women's health and women's research.
Yeah. And because it doesn't even have to be focused specifically on women's health. For example, I was just on a 7-city book tour to promote my book, and I was in Toronto, Canada at a health innovation hub, and I gave a talk on the rise of FemTech, and a gentleman came up to me and he says, I study traumatic brain injury. He goes, I've never asked the question whether or not your sex, female or male, has to have any effect on recovery from a traumatic brain injury. And I said, or how about postmenopause? And he was like, his mind was just being blown in that moment, that he was like, how have I never thought about this factor in my research? And then after him, a woman came up and she said, I study circadian rhythms, your sleep patterns. And she said, I don't know if I've ever actually read a paper on how your circadian rhythm might change during ovulation or after menopause. And she was like, I'm going to go look it up. And if it's not there, maybe I'll research it. So it was so cool to see, once again, like back to the not boobs and tubes, right? Like literally what my mission actually is a sex and gender mission that affects every aspect of healthcare and life sciences, and not just the uterus.
I love that. And there are so many different ways, because like we said, the research isn't there because we've never even been considered a part of the equation, even though we kind of created the equation. So there are so many opportunities and so many things that we can even translate into research that's already there to take it a step further and just look about how
that's right.
Since you mentioned it, I'm dying to hear about it. Can you tell us more about the book and give us a little sneak peek in what people can expect?
Absolutely. So again, back in 2019, when I came across FemTech, at that point, the word had only been around for 3 years. I'm a person, I love to read. I love to deep dive. I want to learn more. And there was no book on FemTech. Even today, if you look on Amazon, put in FemTech, you won't find anything. And so I honestly just wanted to make a cornerstone book that is like a reference book for the industry, so that when anyone says, I'm interested in women's health, the person across the table says, well, first you got to read Unlocking Women's Health, because it's a good introduction of the whole industry. So that's how I wrote it. And what I did was I took 100 interviews from the FemTech Focus podcast, transcribed them, and essentially made a resource book that gives you not too deep, kind of a shallow introduction, but across 18 verticals of women's health. And so it's a really good introduction that then later you can say, wow, that breastfeeding chapter was so interesting. I want to learn more about that vertical. And you can go and do more reading or research. But essentially what I've done is the first chapter is the introduction of FemTech. How did we get here? Healthcare has been here. Women have been here. Why is women's health now a thing? So kind of giving that introductory. And then I have 16 chapters outlining 16 women's health verticals, from cancer, mental health, uterine health, vaginal health, etc. Each chapter starts with an introductory essay about how did we get here? For example, in the breastfeeding chapter, I talk about how the Black community has a lot of historical pain around wet nursing, during slavery, and how has that been passed down culturally through the Black community, and how do they current day think about breastfeeding? And so talking about both the cultural and societal aspects of different women's health verticals. And then I feature 5 to 7 innovators that are creating amazing, awesome, revolutionary products and services for that specific condition or vertical. And then I wrap up the book with talking about investing in women's health, some unique challenges. For example, we have a really big issue with marketing and censorship in women's health. Women's bodies have been so sexualized that we can't talk about breastfeeding without being blocked on Meta. We can't talk about vaginal dryness without being blocked. And yet at the same time, it's truly discrimination because, and inequality, because you see erectile dysfunction every single hour of every single day on every single platform, but we can't talk about vaginal dryness. And so there is a real inequality between men's health and women's health, censorship of our bodies. And so I talk about that in the book. And then the last chapter, I talk about looking ahead. I truly believe the future of humanity depends on FemTech. And that has to do with fertility rates dropping around the world, as well as overpopulation in other parts of the world. And how we handle that is going to be very much dependent on the technologies we're creating today. And then also kind of fun and maybe unexpected, I talk about space travel. So if we are, I know it's kind of random, but if we're thinking about going to the moon and setting up a station, or if we're thinking about going to Mars, we literally know nothing about female biology in space. The first time a woman went into outer space, the engineers for 7 days packed her 100 tampons. Okay. Every ounce of weight matters. And they packed her 100 tampons for 7 days. And she wasn't even menstruating that week. So anyways, we need to learn a lot more about female biology in space if we want to send women anywhere besides Earth.
I love that. And I'm so excited to dive into the book, because there are so many different things that you talked about that are so important for us to talk about. Number one, my rant, and a rant of most of my girlfriends who were in med school with me, is we had so many lectures. Like, I think every lecture kind of started like pulmonary and things like that, on like how we could utilize like Viagra and Cialis. And I don't really remember, maybe one block was on women's health out of 4 years, outside of like OBGYN and stuff. And it's ridiculous. Like you said, like we talk about Viagra. There are so many commercials, so many different ads and things about things that help with erectile dysfunction. And that's something, that's a medical condition that needs to be helped. But what about women? And why aren't we researching things to help women? And why are we sexualizing like body parts? Why can't we say certain body parts is censored out? So it doesn't really make any sense, and we need to create change around that. The tampons in space is hilarious. Like, you're not even on your period and you need 100 of them. Just throw 12 boxes, just pack it. We don't know what she needs. So we definitely have to educate people on how the body works. And I think that kind of goes into even people who are working to do B2B sales for different initiatives or different innovations where we're talking about how we can help employees and things like that. So
Right.
like where men don't know, like some of the European countries are coming out with some postmenopause type help. There are a lot of organizations who are just starting to give fertility benefits. And we know that in this world where we're having to delay fertility because of the structure of our culture, where people are waiting a little longer, going to school, all the things, that lots of women have fertility issues. Lots of women don't even know their options. I was talking with a friend yesterday who is, I'm about to share my age, guys, 38. We're a day apart. And Leo season, our birthdays are coming up. And we were talking about she broke up with her boyfriend, long story short, and I was asking her if she had thought about freezing her eggs.
Mm-hmm.
And she had never really heard about it. And she thought that women's fertility lasted till she was at least be like, she's like, well, didn't Janet Jackson have a baby when she was 50? And I'm like, oh, honey, like, it's okay if you don't want to do those things, but you should look into it now. So these conversations need to be had, because a lot of times it's often too late when women learn about things that they could have had.
That's right. That's right. Also, speaking of women's health in the workplace, I have developed a theory over the last year that one of the biggest leaks to the pipeline of women in leadership in the workplace is actually menopause. So the more that I learn about the effects of menopause, and more surveys are coming out and being published about women being surveyed in the workplace, or women who have already left the workplace and asking why. We never ask them about menopause, and turns out it's one of the main factors for women leaving the workplace because their symptoms were just too unbearable. And so I think we've been talking a lot about DEI and diversity and getting women on boards and leadership, but we haven't considered if women are unwell, no matter how much training or opportunity we give them, if they're sick, they won't stay. And so we need to really make sure that, yes, we need to provide all these opportunity and training, but we also need to make sure that they feel well enough that they can be successful in leadership.
Absolutely. There's so many different things, even like that, when you're talking about, like, we're not just boobs and tubes. I think a lot with menopause, people just think about hot flashes or mood swings. And there's so many symptoms with menopause that you may not even realize may be contributing to a decline in your work productivity or happiness, satisfaction, issues between employees that may need conflict resolution, people taking off work. All of those different things can contribute to how well your business is. So it's very important to think about how you can best support people who are going through these different changes in life.
That's right. I heard a woman recently was giving a talk, and she's experiencing menopause symptoms, and she says that she calls it mental pause because one of her main side effects is essentially like brain fog and brain farts. And I recently had COVID the other week, and I was experiencing that side effect of talking, and then in the middle I was like, wait, I forgot what I was saying. And the woman on the call was like, oh, welcome to, that's menopause. That's what it feels like. And I said, my gosh, if this is what that menopause symptom feels like, that is so frustrating, especially, again, women in executive leadership or management, or, like, how can you function at your best when your brain is constantly like short circuiting because of the estrogen lack in your brain? So yeah, we have a lot of research to do. We have a lot of resources to think through. And the one of the exciting things is that women are now 50% of the workforce, and employers are now required to think about our health and wellness. I wish it was just because they cared. Hopefully some care, but they also have a really good argument. We have a great argument now that they need to care because it's affecting their bottom line. It's affecting their productivity of their company when 50% of your workforce is unwell. And so we're going to continue to see strides towards advancing women's health in the benefit of capitalism. But I'm hoping that once women are well enough, we can also start to change the system.
Absolutely. Speaking of that, you spoke a lot about some of the upcoming verticals that maybe causing some excitement in the FemTech world. Are there any that stand out to you in particular?
Yeah. So, when I started back in 2019, the two areas I used to say was pelvic floor health and menopause. I'm happy to report that there are so many companies now addressing those issues, and I'm excited to see where they go. In fact, 75% of all menopause startups were founded in the last 5 years. So, a lot of great traction for those two verticals. Today, what I'm seeing is a lot more attention to women's mental health. And I really like this because obviously mental health is gender agnostic, it's sex agnostic. But at the same time, what we see in women's mental health is that a lot of times our mental health is tied to a life event. So puberty and the activation of those hormones and transformation of our bodies has to do with fertility or infertility. There's a lot of depression and anxiety around that. Then we have the postpartum depression and anxiety. Then you have menopause depression. And so we see a lot of areas in women's health that the mental health is linked with the rest of the body. And how can we create mental health solutions or programs that are specifically around that? So instead of just general counseling or general therapy, why not make miscarriage specific resources, platforms that are specifically catered to women struggling with infertility and coaching them in a way that's appropriate for their current circumstance, and also understanding the biology behind it. The postpartum depression is heavily influenced by the hormones. So we need to be understanding, how can we do maybe daily testing of hormones and cortisol levels in order to accurately and appropriately help this woman, versus just saying, well, this is typical or this is normal. You just have to get through it. How about we learn more about it and create solutions specifically addressing them? So I'm really excited about the mental health aspect of women's health.
Absolutely. Now we both know, like we both go to a bunch of conferences and talk to a bunch of leaders, that AI is having a moment. Everywhere you look, I was talking about
everywhere.
incorporate AI into healthcare and all of the things. And we know that AI isn't new. There are certain risks that come with it, but there are also great opportunities. How do you see artificial intelligence playing a role in the future of FemTech?
Yeah. There's a two-folded answer. So the first is that if we don't start creating more data sets around women's health, AI is going to be a male AI. It is all it's ever learned is data sets that are based on male health data. And so all of its understanding of humanity will have a male gaze to it. And so that's a danger that we really need to think about. So anyone working with AI, the data sets that you're putting into it, if you're not asking yourself, is this considering sex and gender, you really need to incorporate that. But once again, I'd love to also talk about the opportunity. So we see some really amazing ways that AI is being used in women's health. So first of all, there's been 5 AI algorithms created that have been scientifically proven to predict your 5-year risk of breast cancer. And even more specifically, what these algorithms can do is they can look at a mammogram of a woman's breast, of which a radiologist has reported no signs of cancer, very healthy. And the AI algorithms are saying, no, she's going to, and it's like 98% correct, that she's going to have cancer show up in the next 5 years. And so that is, it's like predicting the future, but it also means that the AI has learned and is seeing something that we don't even recognize yet, like that it has been fed so many mammograms and so many diagnostics that it actually can see things that we're not seeing as potential hazards for cancer in these images. And breast cancer is essentially curable if you are at stage 1. If you can catch it in stage 1, you're not going to die of breast cancer for the most part. And so we could essentially eradicate breast cancer if we gave all women access to mammograms. That's a whole nother issue, right? It's not when we have access. So if we could give access to every woman, we could essentially eradicate breast cancer using these algorithms. Another version of AI I'm really excited about, there's an AI company called MIM Fertility, MIM. And what they've done is they fed an algorithm hundreds of thousands of images of embryos for IVF. And they told the algorithms whether or not the embryo was successfully implanted or not. And so now what the AI can do is accurately assess and actually give a score to all the embryos that the embryologist is looking to in the microscope, so the embryologist can more effectively pick the right embryo to implant into the female patient. This is really big deal because these embryologists are experts and, they're looking for certain characteristics, but similar to the breast cancer, these AI algorithms are seeing things that even the embryologist can't see, whether it's because they're not looking for it or maybe it's even naked to the human eye. And so being able to have these algorithms score the embryos, it's dramatically increasing the success of IVF. So those are two ways that I'm really excited about how AI is streamlining and making women's health better.
I think that that's fantastic. Like, we're basically on the way to having these algorithms and innovations cure breast cancer the way that we use HPV vaccines, where we can have things that are preventable, like seen. I think that it's fascinating. And then even with the IVF stories, like there are so many women out there who have hard times with finding successful pregnancies and all of that. So it may take some of that trouble away from finding the right embryos and seeing what would be successful.
And the financial burden. I mean, each cycle of IVF is like $25,000 on average, right? So it's like this algorithm is a $25,000 score potentially, as well as all the emotional, hormonal, physical, all the other stuff. Yeah.
Absolutely. It could definitely change lives. And if we just see with those two examples, there's so many possibilities. And I think that there are a lot of opportunities in terms of AI. There are a lot of fears going on. I'm sure people have seen like how the Kaiser nurses went on strike because they're a little nervous about the protection of their jobs or the safety for patients. But I think a lot of that can be helped by realizing that we are be mandated to have oversight, like the different federal policies that are coming forward. Number one, the AI governance, innovation, and risk management policy from the White House that came out a few months ago. And from there, it's trickling down into all of the things that oversee healthcare, like HHS and VA and stuff. So we're going to have protections. And I really appreciate that in those policies, they talk about if your innovation does not protect public safety or human rights, then you can't go. Don't pass go. So hopefully that will help with some things, and we can help to push for more equity, more accessibility, and focusing on women.
That's right. I mean, I actually wrote an article about that breast cancer algorithm thing. And one of the things I talked about was none of this it matters if women don't get mammograms. And so there was actually, I talked about how could we potentially use AI to figure out which female patients are most at risk to not coming and getting their mammogram, using things like their zip code, using things like their, what if we could use their salary, or what if we could use how many children they have, like how many other factors can we incorporate that actually also scores a patient for how unlikely or likely they are to come back for an annual mammogram, and then actually strategize our marketing or outreach to those women differently based on these types of scores, right? Versus just, putting a billboard up on one highway. What if we knew which exact road had the most number of women who are missing their mammograms, reminding them to go get it? So absolutely, in terms of using this type of intelligence to not only like just improve human health, but also to improve the equity of it.
I love that idea, actually, because big proponent for health equity, as we all should be. And we know that looking at healthcare, like it's a zip code problem. We don't love to talk about it, but it really is the political determinants of health. Where you vote for, that gives you the resources that are in your community. So you have to get out and vote. We know what's happening with women's health right now because of certain votes. So with that being said, there are so many opportunities to impact, and that's where the tech part can help. I was recently at brunch with a friend, and I know y'all, I keep talking about friend stories, but this is what I talk about when I'm like having
this is honestly, this is women's health. Women's health is women talking to other women. Yeah.
We talk about it. So one of my friends is MFM, and that guy's is a maternal fetal medicine doctor. So they deal with high risk pregnancies, and she works at an institution, and they actually got a really large grant to help women like figure out like why they are missing appointments and things like that. And one of her big ideas is because, you know, childcare issues and things. But if there was, long story short, they've had the grant for a long time and they haven't moved on it because they don't have the staff and things like that. So like if they had a partner who could partner with them to help them use data analytics and all of the AI type things to help pinpoint things and actually outreach to their patients, you could be utilizing this money that's sitting there to help women. So
That's
it's
right.
really,
Yeah.
I mean, I feel like we could talk for hours, but
Yeah.
my biggest question, I think, for you now, since we talked about some of the exciting innovations out there, and we talked about how you're a serial entrepreneur and how you have all of these different verticals that you're working on, the FemHealth Insights, your book, doing some investing and teaching people how to invest. If you were a female founder out there, what advice do you have for those that may have a wonderful idea, but they're looking as to how to push it forward?
There is so many resources out there for you. I'm really excited to say that because a few years ago, that wasn't the case. And so now I'm able to really say that. First and foremost, I would say just get involved in the industry and learn about the unique challenges facing femtech companies, because the reason why we're called femtech and not health tech is because we have some different challenges and considerations from the rest of healthcare. So thinking about things like, does a billing code exist for your solution? Are you going to go direct to patient? Are you going to go through a hospital system? Is this a problem that women actually have? And not just a few women, but a lot of women. Who are your competitors? Are other people already working on this idea that you might actually be better off joining their team, bringing your intelligence to that team, maybe even making a co-foundership with somebody who's also in early stages, but maybe they're a software developer and you're more of the product designer on the hardware. And so there's a lot of opportunity to find collaborators and information. Some things I would suggest is subscribing to different FemTech newsletters. FemHealth Insights, we have a weekly newsletter. I also recommend FemTech Insider and FemTech World. Those are two other really great organizations. Depending on where you are in the world, there's actually a lot of FemTech organizations based in different countries. So there's FemTech Canada, there's FemTech Israel, FemTech Japan, FemTech France. And so literally just put femtech and then your country in Google and see if there's an organization in your neck of the woods, and they likely will have local events and local information and reports based on your economy and ecosystem. Another thing you can do is join FemHealth Insights Slack channel. So we have the largest virtual community. So you just go to femhealthinsights.com. You'll see the community tab. You can join our Slack channel for free. We have about 1,300 members in there. And there's channels like In Search Of, or, you know, resources or events. And that's another really great way to get connected, meet people, ask questions. And then there's programs like accelerators. There's FemTech Labs out of London. There's Tech for Ava out of Switzerland. There is another one just launched out of Zambon in Italy. So a lot of opportunities, and all of these applications and cohorts are being promoted in these newsletters and on the Slack channel. So that's how you can find out about them. But before you quit your day job, before you max out your credit cards, I would definitely get as much feedback and resources as you can, because this is not for the faint of heart, and it's a long, long road. And there's nothing wrong with you keeping your day job and working on this just in the evenings or weekends for even a year, you know, until you can establish yourself well enough that you know that you can get a grant or an investment, because What I don't like to see is all these amazing women taking such huge financial risk so early on before they collected enough data to prove out their thesis. So make sure that you're confident in your business model first, confident in your market research, join Facebook groups. If you're working on urinary incontinence, join Facebook groups about urinary incontinence, post a survey, talk to women, survey them. So those are some of my quick advices right off the bat.
I love that. And I think that you made some very valid points. Like, do your market research, make sure that you are filling something that people actually need, like a void. Talk to people who are in your niche, whether or not that's on who you're trying to sell it to, if it's business to business or your consumers, and always keep the end user at mind. And then also, like, have fun with it, but also don't. Entrepreneurship is rough. So we know that you're excited about getting things going, but make sure that you're ready to kind of take that marathon and not just run and dive into it. So it's okay to work on it while you're still working and things like that.
Especially in the US with healthcare, you need healthcare insurance through your employer. So there's definitely considerations about quitting your job and starting a startup.
Absolutely. We do have a question from someone who's watching. We'll see how best we can answer it, from Danielle Davies. She says, read politics. I know it's something people don't want to talk about, but are you at all concerned about the future of FemTech, especially in the US, regarding what we're hearing in regards to things like Project 2025? I hate the idea of backtracking on women's healthcare. Any thoughts or advice?
Oh, I don't mind talking about this. It's critical to talk about this. Thank you so much for your question. I would say we are absolutely backtracking in women's health right now. So I don't even need to actually talk about abortion to talk about all the other things that it's affecting. So let's just put the A word aside for 1 second. You could all imagine what my feelings are about that. But based on the restriction of access to abortion, how is that affecting the rest of women's health? That's what I'm going to talk about for a second. So one of the things is that physicians are so at risk of losing their license in over 20 states in the United States based on the potential, even perception of them giving an abortion, that they are literally leaving the state and getting licensed in other states. So I go to a lot of healthcare conferences, and hospitals are reporting they are now running with maybe 1 or 2 gynecologists for an entire hospital system, for an entire city. And so we see gynecologists and obstetricians literally moving to other states and leaving the states that have these abortion restrictions, not just for not having, being able to perform them, but who's going to be delivering your baby now? Who's going to be doing, your breast exam or your pap smear? Who's going to be helping you with your birth control options or your fertility options when all the gynecologists have left? So that's a huge impact on women's health that has to do with that overturning of Roe v. Wade. Another one is fertility. We saw this in Alabama with IVF. Is the embryo life or not? This is really, really detrimental to the entire fertility industry in terms of the storage of eggs, the storage of embryos, how the process actually works in terms of how many embryos should you make based on what is the state laws for how you have to store them afterwards, or if you even implant 4 and 3, survive, are you going to have triplets? Is your body capable of having triplets? So, and again, that's not necessarily, I'm not even talking about pro-choice or pro-life. I'm talking about just women's health and how that law is trickling through the rest of it and affecting it. And so it's a huge issue. My latest concern I've heard about is there's 3 counties in Texas that just made it literally illegal for pregnant women to drive on interstate highways if you're noticeably pregnant, out of fear that they are leaving the state to get abortion. And I mean, that's as close to Handmaid's Tale as I've ever heard. So we are not in a good spot. And I hope that what that does is activate people to go out and vote. Every time abortion's been on the ballot, it is won. Everyone wants women to have access to this basic healthcare solution. So make sure you're getting out there, talking about it, bringing your friends, because it's critical to every aspect of women's health. It doesn't even have to just do with babies.
I couldn't have said it better myself. As a physician, like if you guys were on this a moment ago, you may have heard me talking about my friend who hasn't been able to utilize the grant they have for their department in maternal fetal medicine. And you may have been like, why aren't they using it? The reason is because all of her other colleagues have left, and she's the only one there seeing all of the patients for this in this healthcare desert. So it's kind of prioritizing the care of the patient. So if there are no doctors left in these opportunities because they're nervous about malpractice or nervous about going to jail for things like this, there is definitely something that we have to advocate. One book I would recommend, and I wish I knew the title, but it's from Dr. Kenneth Edelin. He was a mentor of mine in medical school, an amazing OBGYN, and he was instrumental when Roe v. Wade was originally happening, and he went to jail because of it. And it's an amazing story to read about how we can advocate for women's rights and how we need to stand up for what we believe in. So just kind of look up his name and the book will pop up. I just can't think of the title of it. And speaking of books, I have put the link to your book in the comments. And if you're looking at this, the comments will still be there. And I'll probably just share a post with the links to all the things in it. We also have FemHealth Insights up there. So if you want to join the community or the Slack group that you mentioned and talk with other founders who are focused on FemHealth, get ideas, figure out how you can develop your plans or grow your organization, that is something to join. Before we part ways, I just want to give you an opportunity to say goodbye to our audience, as well as any closing remarks.
Thank you so much. Again, thank you, everyone. I hope that if you found this interesting, you're going to love my book, Unlocking Women's Health. You can pre-order it now. Ships out in September. Join our Slack community. Please DM me, reach out, introduce yourself. I do host weekly office hours and love to meet with people from all different walks of life and hearing about their interest in women's health. And I will end on a note of, I just read a book called Men Explain Things to Me. And it's essentially a feminist book about the mindset of men assuming they know and women doubting themselves. And actually, it's usually the inverse, that women actually know, and the men are talking about something that they really don't know. And that's not all men. But they're talking about this societal baseline that we've been set on and how we operate off of it. And so after reading that book, I was really thinking about, like, FemTech is this feminist movement within health and medicine, and that has been lacking. And it's a really cool, fun, awesome one because it has to do with innovation and technology. And again, I hope you heard from me today. There's a lot of opportunity, a lot of excitement. You know, we can talk all day about how bad it is, but honestly, as a scientist, it excites me how many new projects we can be working on. As a technologist, it excites me how many new medical devices we can come up with. And so when I think about now that we have enough women in STEM and medicine, that we're taking that charge saying sex and gender are important variables, we are in a tough spot right now for women's health, but I want to also promise you in the next 2 decades, we're going to see so many more solutions. And again, as women get more well, we will be in more leadership positions. And as more women are in more leadership positions, we're going to be creating more guidelines and rules that empower women. So although it doesn't look good right now, we're also at the same time building a foundation that we're going to launch off of.
I am so thankful that you were able to take the time and share your words of wisdom and knowledge base with our audience. For those who are watching who may have chimed in a little later, we know it's an interesting time of the day. We will have this content on our LinkedIn pages, and it will be on YouTube under Digital Risk Compliance Solutions. I'll post a link to that later in the week as well. You have lots of thank yous and kudos coming in.
Oh, yay.
Tina says, thank you so much. So informative and insightful and infuriating, which is why we're all here and working in FemHealth. So for all of y'all that are watching, keep fighting the good fight. I will be having some more sessions like this throughout the month. I have about 2 a month, so just stay tuned if you see anything like that. We'll have all of the links posted for you guys. And let us know if you have any questions. It was so nice to be here, and see you all later.
Bye.